So good afternoon, everyone. I'm Dr. Joss Reimer, Medical Lead, Manitoba's Vaccine Implementation Task Force. On Friday, Health Canada authorized the use of Pfizer COVID-19 vaccine in children aged 5 to 11. This is the first COVID-19 vaccine approved in Canada for the use in this age group and marks a major milestone in our collective fight against the virus. The vaccine was first authorized for use in people 16 years of age and older in December of 2020. And in May, it was authorized for children aged 12 to 15. And now Health Canada has completed a thorough scientific review of the evidence and has determined that the vaccine's benefits outweigh the risks in this age group.
Recording in progress.
So if you are a parent or caregiver of a child in the 5 to 11 age group, this news will come as a great relief to most of you, because parents and everyone who cares for children want more than for the kids to be safe and protected from harm. We do expect that, according to the results of our research here in Manitoba, a large majority of parents will be getting their children immunized. I want to assure you that we will have ample supply of the vaccine to meet this demand. In fact, we're told that the shipment of the vaccine will be arriving in Winnipeg tomorrow. And there is more good news. The clinical trials showed that even with the lower dose, the immune response in younger children was just as good as in people aged 16 to 26, and it was strong. There were also no safety signals identified during clinical trials for this vaccine. And for this age group, there were no cases of myocarditis or pericarditis identified in the trial. As of 6 o'clock this morning, appointments were opened up for bookings through our provincial call center and website. As of an hour ago, more than 15,000 appointments have been made for children in this age group. The vaccine will be offered through our dedicated vaccine clinics, through physicians' offices, pharmacies, urban Indigenous clinics, and Popup community clinics. We have a vaccine finder map on our website, so you can find a place to go that is close to home and convenient for you. There are literally hundreds of options to choose from. The vaccine will be arriving in participating medical clinics and pharmacies between November 25th and 29th. Let me be clear that none of the pharmacies or clinics currently have the pediatric vaccine, but they will very soon. As soon as the details are finalized on which sites will have the vaccine, we will update the vaccine finder map so that you can look there to see where all of the options are available to you. Appointments can currently be booked at the provincial vaccine clinics, with the first appointments being booked for this Thursday. I want to share just a bit more of the clinical findings before answering any questions. So Health Canada reports that the vaccine was 90.7% efficacious at preventing COVID-19 in children 5 to 11 years of age. No serious side effects, including myocarditis, were identified in the trial. The vaccine will be given in a 2-dose regimen of 10 micrograms, which is 1/3 the dose of the adolescent or adult dose of 30 micrograms. The gathering of scientific data is an ongoing process. Health Canada requires Pfizer-BioNTech to continue providing information to Health Canada on the safety and efficacy of the vaccine for kids in this age group. This means that more data from ongoing studies and real-world use will be collected to make sure that the vaccine's benefits continue to outweigh any risks. It also means that there is a continuing requirement to detect and report on any potential new safety signals for any age group. So Health Canada, the Public Health Agency of Canada, and the National Advisory Committee on Immunization will continue to closely monitor the safety of this vaccine and take any action if safety concerns are identified. So speaking of the National Advisory Committee on Immunization, or NACI, on Friday, they also came out with their recommendations on the use of the Pfizer Comirnaty vaccine for younger children. NACI is an independent advisory body that provides the Public Health Agency of Canada, along with the province and territories, with medical and scientific advice on immunization, including for COVID-19. NACI recommends that a complete series of the Pfizer-BioNTech, also known as the Comirnaty COVID-19 vaccine of 10 micrograms, may be offered to children 5 to 11 years of age who do not have any contraindications to the vaccine. They further recommend a dosing interval of at least 8 weeks between the first and second dose. Likewise, for most children, Manitoba will be using an 8-week interval in between dose 1 and dose 2. The 8-week interval has been shown to provide a stronger and longer-lasting protection against COVID-19. However, in some situations, doses may be given closer together after discussing the risks and benefits with your child's healthcare provider or as recommended by the relevant public health authority. For example, the First Nations Pandemic Response Coordination Team is recommending that for children living on reserve, that a shorter interval should be used. This is due to an increased risk of exposure to the virus, increased frequency of school disruptions, and an increased risk of severe outcomes being experienced by these children. This means that a faster immune response may be more beneficial than waiting for the stronger, longer-lasting immune response that an 8-week interval can bring. For other communities, the local public health authorities will work with the provincial clinical teams to determine if any other communities may benefit from a shorter interval. We also have the benefit of watching what's happening in the United States as they've started immunizing this age group before us, and we'll certainly consider their findings to determine if we should be changing away from an 8-week interval for any other groups. I want to outline some of the real risks that your child is exposed to if they're not vaccinated. Over the course of the pandemic, over 6,000 Manitoba children have contracted the virus. The evidence so far has shown that most children experience mild COVID-19 disease, but they can still pass it along to others who may be more vulnerable, and those who catch it from a child can then spread it broadly as well. In some cases, even healthy children have become severely ill with COVID and required hospitalization. In fact, in Manitoba, 27 children between the ages of 5 and 11 required hospitalization for COVID-19, and 7 required ICU admission. A visit to an ICU is a very traumatic experience for a child and for their families. There is also the potential for long-lasting adverse health effects from the virus. Children are also at risk of developing a unique syndrome to children called multisystem inflammatory syndrome, or MIS-C. This occurs following a COVID-19 infection. It is a severe syndrome that occurs weeks after the COVID-19 infection and affects all parts of the body. It often requires hospitalization and can even require ICU admission for children. While the evidence is limited in pediatric populations, children may also be at risk of post-COVID-19 condition, also known as long COVID or post-acute COVID-19 syndrome. Current evidence suggests the risk is lower in children compared to older age groups, but the impact can be great. It can impact children's concentration in schools. It can impact their ability to participate in sports and other recreational activities. And so it remains an important thing that we need to think about related to this vaccine. And of course, all children continue to be affected by school, social, and recreational disruptions that can all be reduced if your child is vaccinated. When we think about how the actions of one person affect others, just imagine the situation of one individual child, a child who may be strong and healthy, but unvaccinated and becomes sick with COVID-19. Even if the child does not become severely ill, that child's illness can result in an untold number of transmissions. So all of this together can burden our healthcare system, impact our own lives at home, at school, at work, and in the community. In some of the saddest scenarios, it can cause death to someone that we love or someone that we may not know, but whose life is just as important as our own. Children have also experienced many challenges in this pandemic, from school disruptions to social isolation, to reduced access to the activities that they love. It's been hard on their mental, it's been hard on their physical health. We know these harms affect some people more than others, And a huge part of the vaccine campaign is making sure that racialized and Indigenous communities, refugees, newcomers to our province, people who are in low-income settings, and children with disabilities are all protected. So while it may not seem urgent to immediately vaccinate your own healthy child, I do ask you to remember two things. The first is that all children in Manitoba are being negatively impacted by this virus, but also that every child is surrounded by a village of people, and that every village of people needs protection. We really are all in this together. So I am happy to now take questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from Global, Abigail.
Hi, Dr. Reimer. I'm just wondering, is it too soon to look at kids getting vaccinated who are younger than 5? Is there any data available for that yet?
At this point, we haven't seen any data on children below the age of 5. However, we do know that Pfizer is running a study down to 6 months of age. So we don't know exactly when that study will be completed or when they'll submit to Health Canada for approval. But we do anticipate that at some point in the coming months that they will complete that study and submit their data for potential approval.
Okay, and I also wanted to touch on bullying a little bit. Just in school age groups, do you have any advice for teachers who might experience this in their classroom, depending on what parents choose for their kids?
I think that what you just said is one of the important things to keep in mind is that many of these children do not have the choice of whether or not to get the vaccine, and it's a decision that's made by their parents. And what we want is for all children to experience the benefits of school, the benefits of recreational activity, the benefits of social settings. And so we want all children and all families to be respected regardless of what choice they make, so that we can have those healthy, happy environments for our children to thrive and grow. And regardless of COVID, that's really critical that we do respect and support all of the children that we have in our communities.
From the Brandon Sun, Karen.
Good afternoon. Just for my own curious side, does this have to be an mRNA vaccine? Can they maybe go to a virus vector vaccine for the second shot?
So the only vaccines that are currently approved for this age group, the only vaccine currently approved for this age group is the Pfizer Comirnaty vaccine, the pediatric dose, the 1/3 dose. There have not been any other vaccines approved by Health Canada to go below age 12.
Okay. And on that, have you heard anything from Moderna? I was told that they are working on a pediatric vaccine.
Yeah, they are also working on that. I don't believe they've completed or submitted their trial data, so we haven't had a chance to see what they may have found, but they are indeed also working on trials in children who are below the age of 12.
Okay.
From CJOB, Skylar.
Hi, Dr. Reimer. I know I asked you about this last week, sorry. The rate of hospitalizations among fully vaccinated people is going up. And as you explained last week, obviously there's a much bigger pool of fully vaccinated people to draw from. However, that rate seems to still be going up despite, the rate of people getting fully vaccinated slowing down considerably. Is there anything you can attribute this to, or is this more just regression to the mean?
Well, I think that there's two big contributing factors to seeing more people who are fully vaccinated ending up in the hospital related to COVID-19. The first is what you did mention. The vast majority of Manitobans are fully vaccinated, meaning that most of the people who could be exposed to the virus will be fully vaccinated. And so we do anticipate that will play a role in how many breakthrough infections occur compared to cases in the much smaller unvaccinated population. But on top of that, we have seen data from other countries, and we're beginning to see data in Manitoba as well, showing that for elderly individuals or people with multiple health conditions, that when you get past, the 5 to 6 month mark, that you do start to see some decrease in protection against severe outcomes. And that's why we're recommending the booster dose in particular for people who are over the age of 70, as well as people who have one of the list of many health conditions that we have on our website, because we know that they are still somewhat protected, but less than they were after the original 2 doses. And so it's important to get that booster dose to increase that protection to where it started, and probably even above where it started. What we've seen with other vaccines is that the booster can bring protection even higher than the original series, and that seems to be what we're seeing in the very early data we have from some other countries as well.
Perfect. Thank you for that. And just as a follow-up, I know you also talked about this last week. The 10 microgram dose would be handed out to a child aged 11, say, later this week. If they happen to turn 12 in between their first and second shots, they would be given the adult 30 microgram dose. Did get a lot of questions last week and over the weekend just from parents that didn't really understand the difference, but I tried explaining to them that the age 12 isn't some sort of magic number. It is a little arbitrary. Could you maybe put that in more eloquent words than I did?
Well, the trials were really only included children who were 12 and over for the adolescent dose and who were 5 to 11 in the pediatric dose. So it's not that age 12 is a special age where anything changes in particular related to a child's growth and development, but rather that cutoffs always have to be set in trials. And so the evidence that we have shows that kids who are 5, 6, 7, 8, 9, 10, and 11 all had a very strong immune response to the lower dose vaccine. We also saw that children who are 12 and above had a great response to the 30 microgram or the adolescent adult dose of the vaccine. And so what we want to do is use the best evidence we have available. And for children who are 5 to 11, the best evidence comes from the trial using the 10 microgram or the pediatric dose, showing that it created a great immune response with minimal side effects. For children 12 and above, we have the same confidence and greater confidence in that it's been used, and we have more real world data showing that the 30 microgram or the adolescent adult dose is great at producing that strong immune response. So if a child is 11, when they're coming for dose 1, they would get the pediatric dose because that's the best evidence we have for that 11-year-old. When they turn 12, we'll use the adolescent adult dose because, again, the best evidence that we have looked at how they as a 12-year-old would be impacted by that dose.
From the Winnipeg Sun, Glenn.
Yes, good afternoon, Dr. Reimer. Glenn Dawkins from the Winnipeg Sun. I guess the question, I know you touched on it in your opening remarks, but I just wanted to go back to it. Parents who may be concerned about having their children receive the dose, I'm just wondering what you would say to those parents who may be having concerns about having their children be vaccinated under the age of 12.
I think the first thing I would say is that I'm really glad that you're taking it seriously and trying to understand all of the risks and benefits for your child. It's an important decision, and we want to provide all of the best information to help you make that decision. What we've seen in the trial was that this provided an excellent immune response. It provided an immune response that was just as good as the older kids and young adults. And so we want to protect the children of Manitoba. We want to give this tool that can protect them against the virus, protect them against severe outcomes like ending up in the hospital, protect them against the long symptoms of COVID that some kids will experience, protect them against some of the severe outcomes like NACI that can happen related to a COVID infection, and protect them when it comes to school disruptions or not being able to participate in sports or other activities, because all of those are so important for our children's mental, social, and physical development. So we've looked at all of these different factors. We've looked at the risk of the vaccine itself and found that the benefits really do outweigh the risks. So the decision to vaccinate a child provides more protection and fewer risks than the decision not to vaccinate a child. And that's what Health Canada told us in their review. So, we really want parents to think seriously about it and come and ask questions of your family doctor, your pediatrician. If you're going to the pharmacy, talk to your pharmacist, and check online as well, because we'll continue to update our resources to be able to answer questions that parents should have when they're thinking about this decision.
Yes, and for my follow-up, the vaccine bulletin also talks about 14-day interval, I believe it is, between receiving other vaccinations and getting your COVID vaccination. Can you speak a little more to that?
So that was a NACI recommendation. So they have said that right now they're recommending that you not get any other vaccines 14 days before or after a COVID-19 vaccine for children age 5 to 11. Now, the main reason for this is just in case the child experiences any side effects, it helps us understand what may have been contributing to those symptoms. Whereas if they've gotten multiple vaccines, it can become very difficult to tease out what, if any of them, may have been related to what the child is experiencing. Now, all of that said, we don't have any specific concerns that if you had another vaccine that would make this one less effective. We don't have any concerns that this would put the child at higher risk of any side effects. It really does come down to us understanding the situation and being able to gather better data to predict what the experience will be better going forward. So while we do recommend that you not receive anything 14 days before or after the COVID-19 vaccine if it's a child age 5 to 11, we also aren't going to be turning children away if they come to one of the provincially or regionally run vaccine clinics to receive their COVID-19 vaccine, even if they did get a vaccine, within the 2 weeks prior to arrival. We'll give them that information, that recommendation, but we certainly are not going to turn them away if they'd like to proceed.
From CBC Manitoba, Bart.
Hi, Dr. Reimer. We are hearing that the vaccine appointments at the Steinbach super site in the Southern Health region aren't available now until December 9th. That's weeks past the booking availability in Winnipeg at this point of the day. Why aren't doses going to be available there sooner? Why was there not more capacity built in Southern Health, given relatively low vax rate and the highest infection rate in the province?
Yeah, thanks for that question, Bart. I have heard that the Steinbach uptake was greater than we were expecting, and that the vaccine appointments filled up very quickly, which was really wonderful to hear. And so the team working with Southern and working with that site specifically is opening up more appointments and more dates to allow more children to get the vaccine earlier and not have to wait until later on going into December. So I would encourage parents in that area to check back, because we do intend to adjust the appointments that are available depending on demand. It's tricky for us to predict exactly how many children are going to book compared to what we did with previous eligibility changes, because there's so many more options available to parents right now. When we were looking at some of the other age groups, there were some clinics or pharmacies that had some doses, but most people were coming through super sites. That's not the case anymore. There's many options available to people. So we are trying to, in real time, respond to the demand and make sure that people have convenient options available to them in a timely way, but it will require us to do some adjustments on a day-to-day basis to open up appointments to meet that demand.
Thank you for that. Now, I was hearing anecdotal reports of uptake for the vaccination in schools program that recently concluded for the kids aged 12 to 17. And in some cases, reports that I haven't been able to confirm, that lack of cooperation even for Manitoba education, superintendents, principals, even because of some of the pushback from some of the parents who may be less enthusiastic about vaccines. What measures are you going to put in place here to ensure that you can get those vaccines into the school program to the 5 to 11 kids, in spite of some of that lack of enthusiasm, either allegedly from administration or for certain maybe some of the families might have other things on their mind, especially keeping in mind low-income families have on their plate, and they may rush out to be getting their kids vaccinated the way that some other people with resources are able to do. Sorry for the long question.
Yeah, so that is accurate that there were some schools that declined to participate in the 12 to 17-year-old vaccine rollout into schools. We're continuing to have conversations with all of the schools and all of the school divisions, not only about the 12 to 17-year-olds, but also about this 5 to 11 age group. One of the big things that I think is creating more comfort with the 5 to 11-year-olds is that all of these individuals will be requiring parental consent. And so while parents won't necessarily be present if their child is immunized in a school, they will be providing that signed consent form ahead of time in all of the cases. And so I think that's helping build some of the comfort for parents and for the schools themselves about how this program can move forward. But we'll also be doing things like having after-hour clinics in some of the schools as well, if parents want to be there with their children, to add that further layer of comfort that they can be present and spend that time with their child to help them feel as comfortable as possible receiving the vaccine and get their questions answered because they're able to be present at the same time. So we want to have that option available, and we want to have these conversations ongoing with schools that may take a bit more time to make their decisions, knowing that they can come back to us and that we're not closing the door on any school if they need more time to prepare and talk to the families of the kids in their school, that we're certainly happy to come back and discuss again at a later date if that's something that they aren't able to sign up for right at the beginning.
From the Canadian Press, Steve.
Oh, hi, Dr. Reimer. You mentioned 15,000 appointments had been booked as of about 1 p.m. today. Are you encouraged by that uptake?
No, we really weren't sure exactly what to expect, but I was really excited to hear that, just in the first, I think it was in the first few hours this morning, we had already hit an 8,000 mark. And then, by about 1 o'clock this afternoon, the last number I heard was 15,475 appointments. And so that's just wonderful to hear that, more than 10% of this whole population was already booked by, the first half day that they were able to book. And that's just the ones who are planning to go to one of the provincial or regional run options. There's still going to be many children who would prefer to go to their family doctor, to their local pharmacy, to their pediatrician. And those numbers, we don't know yet how many kids are going to go through those routes instead of the provincial booking system. So I would say we were extremely encouraged by how eager parents were to sign their kids up as soon as possible. And, having so many people wanting to book at the same time is a problem that we're really happy to have.
And I may have missed this earlier, but when do you see school clinics starting up?
So the regional health authorities are connecting, as we speak, with all of the schools and all of the school divisions in the province. And we know that they'll be starting with some of the school clinics, as early as next week. But we don't have any finalized dates yet for any of the school clinics, because that really needed to wait until we knew when the vaccine would be arriving in Manitoba, and we only just had that confirmed for us. So, I don't have any updates on exactly when the first school clinic will be, other than to say that we're really trying to get things moving as quickly as we possibly can.
From CTV Winnipeg, Michelle.
Hi, Dr. Reimer. We know that the older kids up down to 12, there's some vaccine mandates if they want to participate in sports. What discussions are happening around this younger age group?
So there's no immediate plans to use any of the public health orders to apply to the 5 to 11 age group. We really want to think very carefully about this age group in particular because they don't generally have the option to choose to get the vaccine themselves. It's typically a decision that's made for them. So we want to be very cautious about using any of the public health orders to apply to this age group. We also know for this age group that thankfully many of them do not get severely ill. And so again, to use the public health orders is something that we need to be really cautious about. So all of that said, it really always depends on what we see in the epidemiology. If we had evidence that severe outcomes were increasing in this group, or that it was a major risk to the healthcare system or to others or to children themselves, it's certainly a tool in the toolbox, but not one that I expect we'll be using in the near future.
Thank you. Also wondering, how long do we think it might take to get to that 75% of this age group vaccinated?
So we have a really wonderful array of options available and would be able to provide a high level of doses every day once we get the vaccine in the province. And so a lot of this depends on how quickly parents bring their kids to all of those different options. We've got the over 15,000 appointments booked already, and that's just through the provincial system. But we expect, we know that we've had orders of about 30,000 doses to go out to all of the different pharmacies and physician clinics. And so that's going to be another major contributor to the uptake throughout the province. So this is something that could happen quite quickly, in the next couple of weeks, if that's what parents want to do. But we are going to have to watch carefully and see where the uptake is the highest and make sure that we've got doses going to where is most convenient for parents and at the time that's most convenient for them.
From CHVN, Taylor.
Hi, good afternoon. I know that 15,000 mark is quite a bit, but it's still, quite not exactly the well over 100,000 kids we have in this age group. What do you think about, all of those parents who still haven't booked that first appointment for their kids?
I would say, we're really excited about the 15,000. We're talking about 15,000 parents making an appointment in the first 7 hours that they were able to do so. Many parents haven't even had the opportunity to do that yet. So, it's very encouraging to see that many thousands of people jumping on booking appointments within hours of it being available. And to everyone else, we just look forward to offering your child this vaccine in whatever setting is most convenient to you. We encourage you to use the online system if that's going to be the best setting for you, but also give it a couple days and we'll have the ability to share where all of the pharmacies are and the physician clinics, because for many people, they're waiting on that information. And that's great if they want to have their family doctor be the one that provides the dose for their child, for example. We really encourage that. And so that'll mean waiting a couple days to figure out where that dose is going to be. And then they're going to have to connect with that clinic to figure out when they can get an appointment as well. So because there's so many options available this time, the predictions are a little trickier for us at the provincial level, but we also know that it's so much more convenient for families. And so I'd much rather have a situation where families are experiencing convenient options than a situation where we're able to predict perfectly how many people are going to book on any given day.
Thanks. And my second question may be a little bit out of your wheelhouse, but will it be recommended for classes to continue to learn remotely if there's a COVID outbreak when students aged 5 and up become fully vaccinated?
So that depends on the uptake in that individual class. So we're going to have to look at things like what we're seeing in that community, what's the positivity rate, what's the incidence of cases in that community, how many kids in the school have cases, what % in that school are vaccinated. There's going to be a lot of questions that we are going to have to bring together and make that assessment for each school about what we expect of them. over time, we'll be able to have a better understanding of how things transmit in the community in this age group, depending on the vaccine status of the kids in the community. And so we'll be able to tailor and work with the Department of Education to tailor recommendations for outbreaks overall. But in the near future, it's going to have to be a case-by-case assessment of the individual risk of that school before we can decide when we might recommend something like remote learning for a cohort or even for the whole school.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon, Dr. Reimer. For rural Manitobans, when will they get to see pop-up clinics in their communities, or are you relying on the pharmacies and doctors to cover those areas off?
So what we're doing is trying to meet whatever demand is not met by pharmacies and physician clinics. So in Winnipeg, we do expect that a lot of the doses will be provided in pharmacies and physician clinics because that's what people are used to doing. They're used to getting their flu shot at their local pharmacy. And so that will be something that we expect will continue to occur for the COVID-19 vaccine for this age group as well. In some rural settings, however, there's very few, if any, pharmacies or physician clinics that typically offer vaccine. And in this case as well, there will be very few, if any, in some areas that offer the COVID-19 vaccine. So in those cases, we'll have public health run clinics available to make sure that throughout the province, people can access the vaccine in a convenient way. So some regions will have a larger percentage of the doses being given by public health than Winnipeg does, for example. But in all areas of the province, there will be options available, and public health will be running clinics starting as soon as the vaccine arrives. So we expect that throughout the province, the end of this week, early next week, we'll be running clinics in most communities.
Thanks. So just to clarify, will those appointments become available before the end of this week? I don't know that's an option right now. And just the urban Indigenous clinics, how come there are no appointments there today?
So the urban Indigenous clinics will have doses available and they'll be able to start booking as soon as they're ready to run as well. So each clinic has their own unique hours and unique staffing situations, but they will have doses available to them at the same time as the large dedicated vaccine clinics. And so each region is going to be running those clinics using the unique community setting and community needs that they have available. So I don't have the ability to share, the exact hours and dates for every single clinic, whether it's urban, Indigenous, or any of the other public health run clinics. But each regional health authority is working very hard right now to get pop-ups and get those urban Indigenous clinics up and running as soon as possible. And those bookings will be available in the coming days.
Thank you, Doctor. We have time for a few more brief questions. Please proceed.
I just wanted, would there be any issue if parents, for some reason, decided to wait just slightly longer than the 8 weeks? We're talking maybe 9, 10, or 11 weeks. Would that hurt the efficacy?
So the 8 weeks has been a pretty ideal time frame for adolescents and adults to ensure that they get the strongest immune response possible. But pushing to 9 or 10 weeks would not reduce that immune response with dose 2 at all. So there's no problem. There's probably not much of an additional benefit either to wait till 9 or 10 weeks. But if people needed to do that for whatever scheduling reason, that would not impact the immune response to dose 2, nor the overall strength or time that immunity remains. The only reason to consider going earlier than the 10 weeks is just to get that boost as soon as you can. So 10 weeks is what NACI is telling us is sort of the ideal balance between getting it as soon as possible, but also making sure that the body's had enough time with dose 1 that you get that really strong response to dose 2. So that's why we recommend people not wait longer. Is just, if the child is exposed to the virus at the 9-week or the 10-week mark and they haven't had that second dose yet, their protection is going to be lower than if they'd had the second dose, but they don't need to worry about how well the second dose will work if they wait an additional few weeks.
Dr. Reimer, case rate in Manitoba, which was the highest in the province during the second wave. We're down on about of that for the past few months since most Manitoba have been able to get vaccines. Can you just comment on the number of deaths per case down 50% in nearly a year?
Sorry, Bart, that was really hard to understand. Can you try saying that one more time? I'm just getting a bit of an echo with you.
Forgive me, it's a headset. The percentage, the proportion of deaths case for 100 cases is down almost from nearly a year ago. Just looking for your general comment on declining case fatality rates.
One of the things that's been really reassuring about the vaccines is that, even though we know they don't protect against all infections, that they so clearly are protecting against severe outcomes. So what we've seen, even in Manitoba, we've seen this all around the world, but even in Manitoba, that we've seen that the rate of infections goes down substantially in the vaccinated populations, but it's even more dramatic seeing how the severe outcomes go down. And so that's why we are really just so strongly recommending this vaccine for everyone in Manitoba, because we want to protect everyone in Manitoba, not just from the infection, but from ending up in the hospital, from ending up in the ICU, and above all, from dying of this virus. And that's really what we continue to see. Now, with some older populations, that protection a little bit, it's still very good, but we want it to be great. And so that's where the booster becomes important, to keep that case fatality rate down. So keep it so that even if people become infected, that the likelihood that they become severely ill is so incredibly low. So it's been one example of just how encouraging this vaccine has been. The differences are dramatic. When we see what is going on in our hospitals, in our ICUs, and in the community, it's so remarkable to have this tool available to us, and a tool that's been so safe and caused so few issues around the world to people. We're just so thankful to have this tool available to Manitobans. And so the reason that Manitobans hear us talking about it and pushing it all the time is just because of that dramatic protection that it provides. And we want everyone in Manitoba to experience that protection.
Dr. Reimer, I know herd immunity is probably not your most favorite term, but I think a lot of folks, even those who don't have kids, were kind of banking on this, fairly large subset of our population being made eligible so we could continue to get more people vaccinated. Have you looked forward to, say 75% of this age group gets vaccinated, and what might happen to our transmission and rates of severe outcomes at that point?
Yeah, I think one of the best examples where we are seeing some impact of herd immunity, not textbook 100% herd immunity, but still a lowering of transmission is when we compare the elementary school kids to the high school kids, and what we're seeing as far as rates and transmission in those two different settings. When we look at the outbreaks in schools, when we look at rates overall, we've seen this huge drop in the high school situation where they're having much fewer outbreaks, fewer cases overall, fewer spread in the community and activities and in the schools. And in the younger kids, there's been some decrease. It's not nearly as high as it was with our last wave, but the difference is quite stark, where the high schoolers have had this huge drop and the younger kids have seen a small drop in what they're experiencing as far as outbreaks and transmission in that age group. And so we know that they're benefiting already from having their parents immunized, their teachers immunized, their coaches immunized. They're already getting that decrease. And when we can add them to the group as well, they'll also be contributing to a drop for every other age group. So I don't know if we'll ever hit textbook herd immunity where the virus can't possibly circulate in our communities. We'd probably have to hit like a 90% vaccine uptake in all age groups to get to that perfect textbook herd immunity. But what I do know is that the higher we get in coverage throughout the different age groups, the less transmission we're going to have. And whether you're vaccinated or not, the safer you're going to be. So adding these 125,000 people to the eligibility is going to protect all of us. So we really hope to see high uptake group, just like we hoped for it in every other group, both to protect children, but also to protect all of us.
We have time for a couple more questions. All right, then. Thank you, Doctor. Thanks, everyone. This concludes our session.